Okay. So welcome back. So can you hear me? Are we all here?
Yeah, we can hear you.
Let's look at the audio. No. Okay. Okay, good. So we can carry on.
Yes, you can.
Okay, great. So let's finish these 6 conditions with the fluid system axis or tissue hydration, right? So insufficient hydration, a deficiency in the fluid system creates a dry condition. So there's not so many symptoms with dryness, but we have certainly dry skin, thirst, constipation. Those are probably the main or key symptoms with dryness, okay? Thirst, dry form of constipation. Mentally, dryness creates a scattered thinking. We talk about a scattered brain, someone who cannot focus thoughts. Sorry, I'm not screen sharing here, am I? Here we go. Sorry about that. So here we are, dry condition. With dryness in an individual creates scattered thinking. So they're thinking all over the place. You know, they're distracted all the time. They cannot focus. They change their mind. They have difficulty making decisions. Think of dryness mentally like desert, like dust in the desert, right? Dust or sand in the desert that a wind comes along and blows it up. That's what the thinking is like. And emotionally too, emotional dryness we see as well. So moving over to the excessive moisture creates a damp or congested condition where you see discharges, swelling, toxicosis. So discharges that can be, for example, nasal discharges, rhinitis, sinusitis, swelling, for example, lymphatic glands, swollen glands. You'll see abdominal distension, pelvic distension, and toxicosis is another key factor. So damp, when the fluids congest, elimination slows down, and that creates toxicosis, which means a state of poison accumulation. Poisons accumulate in the system, right? And that can be in the interstitial fluids, in the blood. They can accumulate in the joints, you know, different parts of the body. But so in general, we call that toxicosis. So that's a tissue state that's closely associated with congested fluids and damp. For example, in Chinese medicine, rheumatic arthritic conditions are called wind, damp, cold obstruction, right? Damp obstructs the circulation of qi and fluids in the and channels or meridians in the body. That's the energetic explanation. It's the same. It's a different description for the same phenomenon. Mentally, damp creates brain fog. Again, it feels like the brain feels like it's full of phlegm or foggy, cannot think straight, right? The pulse becomes full or slippery. For example, pregnancy, you know, the state of pregnancy in a woman is obviously healthy. It's a healthy state, but it creates damp. It creates a congestive condition. It's not right. So in pregnancy, for example, the pulse becomes full and slippery. So in this case, it's a healthy type of congestion or damp, right? And then clinically, we talk about damp at different levels, like this damp at the circulation level would be insufficient venous return causing hemorrhoids, varicose veins, okay? So that's blood congestion. Blood congestion also typically occurs in the pelvis, right? Pelvic blood congestion, often just called pelvic congestion, right? Causing menstrual problems, cluttered periods, etc., heavy periods. Congestion also involves the liver organ, the portal vein, the liver. It can also, when it involves fluids in general, it can cause edema, edema of different types. If it affects the lymphatic circulation, it causes swollen lymph glands, and so, etc., right? So the tongue tends to be swollen, wet. The sublingual veins, the two prominent veins under the tongue become swollen, often deep purple. So that's a sign of blood congestion. The complexion tends to be puffy, moist, shiny, okay? You also see that, incidentally, in thyroid dysfunctions, thyroid metabolism dysfunctions. Okay, so this is the whole system in a nutshell. I really do hope that it resonates with you. This is obviously not modern phytotherapy at all. This is a you will see in a moment how I'm trying to combine this with modern pathology. So let's do just that. Okay. Now, when we come to the let's see, I'm trying to think. Now, 3 elements and 4 condition charts. Let's just stay here for a moment. So the next question is, how do we treat these 6 conditions? What are the principles of treatment? So we need to, this is finally we come to the main point of this whole discussion, which is how to make a treatment strategy, and herb selection. What is the basic treatment approach? Another way to put it, treatment strategy approach, and then what herbs do we select? So the treatment in a tense condition is to relax and regulate tension. The classic vitalistic terminology is for the herbs is relaxants, right? This is an umbrella concept that can include specific herb actions like spasmolytic, also known as antispasmodic, spasmolytic, analgesic. So relaxants tend to exert these particular actions. Spasmolytic, they tend to be analgesic, anti-inflammatory, and nervous relaxant in general. Because remember that tension is a hypertonicity of the nervous system, right? The nervous system has heightened tension. Okay. So, and here's a checklist of herbs: melissa, lavender, clary sage, Roman chamomile, etc. Let me go into some of those. Well, we can talk about, let's contrast this with a weak condition, which is how to treat a weak condition, which is lack of healthy tension. We restore tension to strengthen the weakness, to strengthen that which is weak, right? The basic concept in herbal medicine is restoratives. We can also call them tonics, but the word tonic, honestly, is totally misused. So I avoid the word tonic. It doesn't mean anything. People talk about tonics and they mean stimulants or they mean relaxants, you know. So forget about the word tonic. These are restorative. They restore tension and strengthen weak conditions. In general, nervous restoratives. Some of them we specify as being, in the British herbal medicine tradition, we specify them as tropho-restorative, which is, I love that concept. Tropho means nutritive. So they're restorative, they nourish certain tissues. For example, hawthorn berry nourishes the heart and the blood vessels. Horsetail nourishes the tendons and the bones, right? They're tropho-restoratives to these particular organs or body systems, okay? So this is really interesting. We also have I mean, you could talk about cerebral restoratives, restoratives for the particular organs, you know, liver restoratives, lung tonics, lung restoratives, kidney restoratives, uterine restoratives. In practice, you know, certainly my teachers, they all use the word tonics, you know, kidney tonics, lung tonics, you know, which if you know, I prefer the word restorative because it makes your treatment strategy, your treatment intention clearer. Whereas the word tonic is as I said, has become a popular word, which is widely ambiguous. You know, it can mean different things. So we have, let's look at some of these restorative herbs. So I've actually chosen, I've deliberately chosen restoratives for the nervous system here because that's the, you know, in a moment we'll be looking at neurological disorders like insomnia, anxiety, brain fog, and so on, and we'll be using these herbs in treatment. So in the lip flower or labiate, lamiaceae, we have many herbs that work on that strengthen the nervous system. Strengthen weakness, strengthen a weak nervous system. Thyme, basil, sage, rosemary, hyssop. All of these have traditional and research uses for strengthening the nervous system, brain functions, including memory, ability to be alert, to focus, etc. Right? Cardamom we have from India, a traditional Ayurvedic brain tonic, originally from Ayurvedic medicine, Elitaria cardamom. Do you need me to give I don't think I need to give you the Latin name for these. These are so common, right? Schisandra is a Chinese herb, which is an important tonic for the nervous system and brain. I consider it, Schisandra berry, a tropho-restorative, right? Wu Wei Zi, Schisandra.
Peter, so
for the nervous system.
It's very clear, but
Asian ginseng is another one, and both the white and the red. But generally, we use the white ginseng. So white Korean ginseng, white Chinese ginseng. Okay. And then we have aloitoro or tiger root. You know, has different names. Aloitorococcus, right? From East Asia, from Northeast Asia, or the Russian Far East, which also the Far East of China, Chinese Northeast, Harbin, and so on, which is a herb, but that also grows together with rhodiola, right? Rhodiola is similar to alotoro, another fine tonic to the nervous system. But rhodiola is more complex. Well, I'll talk more about rhodiola when we talk about insomnia and so on. Ashwagandha from India, very important herb for the nervous system, and also also reproductive functions. Very high quality restorative herb. Okay. From Mexico, we have Damiana herb. I don't know if you use this in Israel, but it's used actually a lot in England, as it happens. English practitioners. I mean, in my training in England, in herbal medicine in England, we used to use Damiana a lot, right? Skullcap from North America, another fine, more gentler. It's a more gentle restorative to the nervous system. Okay, so although all of these herbs are restorative to the nervous system, they all have slightly different applications, as well. They have a big field in common, but they also can be differentiated. And we'll do some of that when we look at the neurological disorders. So let's look at some relaxant herbs. It's interesting to me how we have so many more specific herb actions for the relaxants than we do for the restoratives, right? Or analgesic, anti-inflammatories, and so on. Melissa officinalis, right? Wonderful, wonderful herb. This is an example of a herb, actually, that can be used in three types of preparations. It can be used in a water preparation as a herbal tea, i.e. infusion, right? It works very nicely. It cools the body down. It's relaxing, and so on. You can make a tincture from it. In other words, an alcoholic extract, and then it becomes more strong. And the essential oil, the particular essential oil extract is available as well in general. So which is even more focused on treating certain pathologies, okay? Because with essential oil, you're extracting just one part of the chemistry, one component, and hope that it, hope that it works in a similar way to the whole plant, the whole herb. Sometimes it does, sometimes it does not. So that's whole other discussion. But anyway, I'm pointing out the fact that with many of these, the herbal infusion, the tincture, and the essential oil are all equally possible preparation forms in treatment. Really fascinating. I find that really interesting. So for example, for patient take-home care, I like to encourage patients to do something for themselves. This helps them take responsibility for their condition, to get involved in their healing process, in the treatment, in their cure. So this is easily done with making herbal teas with melissa, lavender. Most of these they can make nice herbal teas with, and participate in the healing process, right? Which I think is pretty important. Okay. So lavender as well. Lavender I'll talk about these two together because they're very similar. I'm talking about Lavandula angustifolia and Salvia sclarea, which I know that definitely grows in the Middle East, in the Levant. Salvia sclarea, Lavandula angustifolia, not spica, not different plant, okay? So these are 80% used clinically the same way. You can make teas, nice herbal teas from them. You can make wonderful tinctures, and you can use the essential oil as well if you with proper training. I do have to tell you that when you use the essential oil, you need and you use the oils internally, you need a special training. It's not like you can, there's many different delivery techniques that French doctors have developed over 300 years or more, at least. The essential oil is part of the French medical tradition. It's part of French allopathic medicine. And we need to respect that. So if you want to use essential oils, great. I support you, but get trained, seek proper training. That's all I can say. I was lucky because I was introduced I did a training in French internal use of essential oils back in the 1980s, believe it or not. And anyway, that's another story. This is why I mentioned essential oils, because I know they're very popular. There are multi-level organizations that are all over the world. You know who they are. I'm sure you have them in Israel as well as they're in India, they're in Malaysia, they're in the UK, all over the planet. And there's so much misinformation going on that I want to emphasize that please use essential oils with proper training. And that way you will stay safe. So many accidents have occurred with children, with babies. I mean, unbelievable, Essential oils are very strong. They're an alchemical product that was originally developed in Alexandria in Egypt 2,000 years ago. They were not used before that. They were not used in Egypt. They were not used in any previous culture. Yeah, and I know this is off the point, but I think it's relevant because these are well known as lavender is the most popular essential oil on the planet. I mean, do you have any idea how many tons and tons of lavender is used, not only for soaps, for perfumes, etc., but also for beauty care, and for popular aromatherapy. This is the problem, popular aromatherapy. Honestly, I see it as a huge, for us practitioners who want to treat individual people, we do individual prescribing for patients. Popular aromatherapy is a big problem. So be careful, be careful. So get trained. Okay, Roman chamomile too. Most of these are aromatic plants that contain essential oils. This is why I'm digressing a little bit. Roman chamomile, Anthemis nobilis, marjoram, oregano majorana, orange flower. Orange flower we use the bitter orange flower as a relaxant, not the sweet so much, the bitter orange flower. You can make a beautiful tincture from orange flower. I don't know whether you do that or not, but anyway. Tea, and it's certainly a nice sweetener in teas, with these other, if you have patients make herbal teas with these. Linden flower, tilia, okay? Cramp bark from the USA, viburnum, different species of viburnum. Very effective for smooth muscle cramps. Smooth muscle, spasmolytic analgesic, anti-inflammatory to the smooth muscles in particular, right? Hops, humulus, cooling. I use hops when it's a hot condition. When you see tension and heat together, I use hops, right? Because it's very cooling, okay? Motherwort, Leonoris cardiaca, I use when there's heart involved. And this is mainly a relaxant to the cardiovascular system, to the heart, Yeah, cardiovascular tension. The heart can hold tension as well, literally. Most of an angina pectoris is from tension. It's not from atherosclerosis at all. It's actually called Prinzmetal's angina, or Prinzmetal's angina, from tension. St. John's wort, hypericum, black horehound, balata. I like using balata too. So all of these are relaxants with particular uses, targeting different organs, different body systems. Linden flower, I like using for musculoskeletal tension. right? If the tension is on the body's exterior, the skin, the muscles, the person has inability to sweat, then tilia is wonderful. You know? Marjoram too. Marjoram is a wonderful neuromuscular relaxant. Also lavender. Lavender, marjoram, linden, especially target the treat neuromuscular tension. Okay. Okay, moving on to, let's look at some warming. So herbs to treat a hot condition. The treatment principle is to clear heat and calm, right? Cooling sedatives. They tend to be cooling. Refrigerant is the traditional term in Western medicine. It just means cooling, same thing, cooling, anti-inflammatory, and also nervous sedatives. Okay, so we clear heat and we calm the nervous system. Again, melissa, lemongrass. So lemongrass is used all over the world to clear heat, to treat hot conditions, typically for fevers, right? They make all over in tropical countries all over the world, the lemongrass tea is common. You can also make washes, put it on the nape or on the back of the leg to cool down. Lavender is cooling. Lady's mantle, cleavers, gallium. Lady's mantle is alchemilla, gallium, aperine, sorrel. I've forgotten the Latin name. Boneset. This is a classic cooling North American herb that pioneers who traveled to California relied on for treating fevers, to reduce the temperature of fevers, and it's very effective. It also clears heat in the lungs, in the chest. Boneset. I'm trying to think of the Latin name. It escapes me right now. I'm sorry. I'll look it up in the next break, okay? White willow bark is another classic Western botanical for treating fevers, heat, pain, right? What's the Latin? Willow, I've forgotten this one as well, sorry. Anyway, you get the idea. Some of these are also, the first three are aromatic herbs. In other words, they contain essential oils. So again, be careful with melissa oil, lemongrass oil, lavender oil. You know, be careful in order to be effective and stay safe, okay? Cold conditions. The treatment principle is to stimulate, to warm up cold, right? Warming stimulants. So stimulant is different from restorative. Restorative, we're just building and tonifying in a gentle way. But when we use a stimulant, we're pushing the energy a bit further. We're pushing the body to, more strongly. So we differentiate restoratives to the nervous system, also called nervous tonics, from nervous stimulants, right? And these tend to be arterial stimulants as well, because in order to treat cold, we need to stimulate arterial circulation, right? Ginger, cayenne, prickly ash bark, and so on. So we tend to use this in just small quantities in a formula. They're strong. These are strong, intense herbs. So sometimes just 10%, maybe 20% of a formula to warm up the other herbs that we're using within a formula. So ginger is a classic. Cayenne or chili pepper is another classic. Prickly ash bark, also used a lot in England. It's a North American tree, that's prickly ash. By the way, there's also a Chinese prickly ash, but they use the berry more often than the bark. Prickly ash berry from China can be used. Cardamom, originally from India, and black pepper, the warming spices, right? Cardamom, black pepper, nutmeg belongs to this group as well, right? And from Mexico, damiana, right? Which is not as hot as cardamom or black pepper, but it's definitely warming. Okay. Then moving on to the fluid axis, how do we treat dryness? We moisten. We use demulcents, demulcent herbs with a moist quality. And most of these tend to be refrigerant or cooling as well, which is good because very often when you have a dry condition, we have a hot condition. So dryness and heat combine rather easily. So I want to take a step back and share with you, the clinical reality is that tension, heat, and dryness can quickly accumulate or change into each other, right? So someone who is tense can easily become hot as well. So you'll see patients that are both tense and hot quite commonly. Equally, you'll see heat and dryness together. Equally, you'll see tension and dryness together, right? So, for example, someone can have a fever, an infection with a fever, a hot condition, which creates agitation, restlessness, and it creates systemic tension. It tenses up the whole body. It makes them worried, anxious, heat and tension. And a fever, as the temperature climbs, creates dryness. The person feels thirsty, they may get constipated, and so on. So these three can create each other quickly in the same way, weakness, damp and cold can create each other very quickly, right? So you see weak cold conditions in the low back causing low back problems, or problems within the reproductive organs with amenorrhea, prolapse in women. Weak and damp with discharges in the lower warmer, in the urogenital organs. Weak, damp, and cold, right? And in the long run, the opposites can occur. Chronic tension will create weakness. Chronic weakness will create tension. Like if you tense up a rubber band, I should have brought one, it will snap. If you keep on tensing it, it snaps, right? So you see some patients have tension in one part of the body and weakness in another part of the body. Or they may come in once, 1 week, they're all tense. Next week, the weakness is dominant. Often it's alternating tension and weakness, or just both at the same time. Tension and weakness, symptoms of tension and weakness combined, you'll often see. Same with hot and cold. Heat rises. The energy of heat travels up to the head, right? So you get hot symptoms in the lungs, in the throat, etc. Cold below, right? You'll see symptoms of dryness and damp as well. For example, dry skin or dry cough with damp discharges, varicose veins, etc., pelvic congestion. Okay, but that takes longer. The opposites take longer to develop, right? Those are more chronic conditions. Okay. Okay. Getting back to where were we? To the moist demulcents. We have some fine herbs to moisten the tissues, moisten the mucosa. Demulcents work on the mucous membrane chiefly, right? And some of them are better for the lungs, some of them are better for the mucosa in the bladder, in the GI tract. In general, we tend to use them interchangeably, but you can make differentiations between them, among them. You can differentiate, some work more widely on the whole mucosa, mucous membrane. Others work more on particular parts of the mucous membrane. So the two that work most widely are probably comfrey, mallow, comfrey leaf or root, comfrey leaf, mallow, malva, and asparagus. Anyway, yeah. Borage is more particular to the lungs. It has a strong affinity, Borago officinalis, with the beautiful blue flowers. Borage has a particular affinity for dryness and heat in the lungs. Very effective. Okay, dry cough and so on. Plantain as well. I like combining borage and plantain. Plantago, you know, any species of plantago. Excellent for heat and dryness in the lungs. Okay, thirst, dry cough. Okay, asparagus root, wild asparagus, of course, not the edible type. And then the mosses, there's Iceland moss and Irish moss, a type of seaweed. And slippery elm bark from the USA, right? By the way, slippery elm is I believe is endangered. So be careful. I mean, use it only if you need to. I don't use it anymore, honestly. These are perfectly adequate. You know, you don't need to use slippery elm bark at all anymore if you have some of these available, especially Iceland moss. Iceland moss is very systemic as well. Any kind of dryness. Iceland moss is Cetraria islandica. Okay. Okay, and then we have herbs for treating damp conditions or congestive conditions. So the treatment principle is to decongest, to dry, damp. It's very simple. So we use dry or astringent decongestants. Many of these are astringents, but not all, okay? Astringent means to tighten the tissues. We tighten the tissues in order to move the fluids on, right? To circulate, to keep, we astringe to keep the tissues, keep the fluids circulating within their channels, right? Whether it's lymphatic, pelvic, blood, venous circulation, whatever, the veins. Most of them are diuretic as well. And decongestant. Decongestant is the umbrella term, but we also have particular decongestants. We have liver decongestants. We could talk about kidney decongestants or lymphatic decongestants, venous circulatory decongestants that move or activate the venous circulation. In the case of venous stasis, venous circulatory insufficiency, and so on. Okay, so we have dandelion, which obviously works a lot on the kidneys and the liver. Dandelion root, dandelion herb, lovage, ligusticum, dandelion taraxacum, lovage, ligusticum, levisticum, sometimes called levisticum, myrrh, mirra, juniper berry, juniperus, broom, cytisus, broom from North Europe, USA, very powerful diuretic, excellent for congestive heart failure, chronic heart congestion, fluid congestion in the heart, right? Yarrow, achillea, asparagus, goldenrod, solidago, right? Excellent diuretic, very safe. Goldenrod is also trophorestorative to the kidney organ, by the way. Very, very good for toning and strengthening kidney function in the long term. An excellent kidney cleanser, like cleavers as well, gallium. I often use gallium and gallium apparine and goldenrod together to tone and detoxify the kidney. Okay, so I think that's all of them. So that gives you a quick overview of the herbs, you know, and the treatment for each treatment principle. So I'm curious about if there are any questions in chat. So I'm going to take a quick look here. Sorrel, Rumex, Viburnum, yep. No, I don't see any, these are comments. I don't see any actual questions, okay? I hope that means you're not paying attention.
Very attention.
No,
I have a lot
kidding.
of questions in my WhatsApp all the time, so
No.
I don't know why I'm not asking in the chat, but it's very interesting, and you can continue, Peter.
Sorry, my speaker conked out. Yaniv, could you repeat that, please?
Yeah, I told you that my WhatsApp is full of questions. I don't know why they send the question to me and not asking in the chat. So it's very interesting. I think everyone is just, you know, very concentrated in your lecture. You can just continue.
Great. Great. So you have, yeah. Let's look at, let's move on to the treatment of neurological, the particular neurological disorders that I chose. So I chose these ones here. So I want to look at insomnia and anxiety together because they're often combined. Brain fog, inability to think clearly. Depression, which is it's a very complex condition. And anxiety, no, we covered anxiety already. We'll end up with looking at depression, treatment of depression. And with each of these conditions, we classify it according to the terrain. Weak or weak cold type of depression, tense or tense weak type of depression, which creates an anxious depression. Tense or tense hot type of depression, which creates an agitated depression. This is really interesting with depression because we have, clinically, we need to really need to differentiate among the different types of clinical depressions: agitated depression, anxious, and melancholic. So we'll get there. Let's start with insomnia and anxiety, okay? Again, all of these are obviously very common. And I think differentiating them is really useful because the herbs that we use are really different. You know, there are many herbs for insomnia and anxiety, as you know. We immediately think of herbs like valerian and passion flower, lavender, lavender essential oil, etc., etc. But we need to consider the bigger picture. We need to consider the patient's terrain. We need to consider the different the different properties of the herbs. And you know what? I'm going to show you another, I want to show you another chart that before we move on, that I think you'll find four herbs. Hang on. Okay, I'm trying to toggle share screen. Here we go. This is called the 4 remedy actions. And I dare say that, and I hope that some of you are familiar with this, because this is a really very basic concept. That in herbal medicine, in the Anglo tradition, in the North American and British tradition. In fact, Simon Mills I don't know if he still talks about this or not. I have no idea, but Simon Mills was one of my teachers back in England, a long time ago. And he still talked about these 4 essential herbal remedy actions: stimulants versus sedatives, restoratives versus relaxants, stimulate, sedate, restore, relax. So back in the old days, practitioners, herbal medicine practitioners like the Priest brothers, J.J. Priest and his brother, they have a book written which is based on herbal treatment based on these 4 basic actions. And this is another piece of the puzzle that I use in my practice and in my teaching. Okay, so stimulants, as you can tell, hopefully now, stimulants tend to be pungent, dry, warm, hot. They contain essential oils, glycosides, like cardamom, black pepper, damiana, etc. Right? Ginger, cayenne, chili pepper. Okay, they stimulate. These are the basic functions. The arterial stimulants, diaphretics. We use them to cause sweating when they're drunk hot. They can promote urination, bowel movement, expectoration, and they stimulate particular organ functions as well. These are the stimulants. Sedatives tend to be bitter, dry. From the vitalistic or energetic medicine perspective, which includes Chinese medicine, Ayurveda, Tibonani, these are bitter, dry, cool, or cold herbs, right? They contain alkaloids. For example, lobelia is an extreme example. Bupleurum chaihu, a Chinese herb, Bupleurum chaihu. Boneset, right? Willow bark, the glycosides of willow bark, right? Etc., etc. Some of them contain essential oils like lavender, like melissa, okay? Organic acids like sorrel, okay? So these sedatives tend to reduce inflammation, fever, infection, toxins, detoxicant, relieve pain, etc., etc., right? Relaxants, we've also talked about. They pungent, cool, they contain oils, alkaloids, glycosides, they relax the smooth muscles, they can reduce convulsions, they relax particular organ functions too. So we have respiratory relaxants for treating asthma. When there's bronchoconstriction, right, we get asthmatic breathing. We need respiratory relaxants like black cohosh, like bupleurum, etc., right? Hyssop is another good one. Hyssopus, very important respiratory relaxant. So they work on particular organ. We can relax or restore or particular organ functions, right? Musculoskeletal relaxants. Kava is a strong musculoskeletal relaxant. Same with bupleurum chaihu. Same with simisifuga, black cohosh, right? Central nervous relaxants, we just saw a whole bunch, right? restoratives. They can be sweet, they tend to be sweet, moist, and warm. There's two types of restoratives: sweet, moist, warm, that contain saponins, glycosides, trace minerals. For example, the ginsengs, all the ginsengs are sweet, moist, warm restoratives. Also suma root from South America, right? You know, are you familiar with suma? Beautiful, wonderful, restoring, deeply restoring and nourishing, nutritive herb. In the suma is, what's the botanical name again? Pfaffia paniculata from Brazil. I think it's a very important herb. It also builds blood. It's very important for treating anemia, for nutritional deficiency, what we in Chinese medicine we call blood deficiency, right? So these examples of the sweet, moist, warm restorative that contain saponins, which increase absorption of nutrients, by the way. Saponins increase nutrient assimilation in the GI tract, right? Glycosides, trace minerals. A Chinese herb, apart from ginseng, that contains this is dangshan, Codonopsis dangshan, a very important herb for both blood and qi. It increases nutrition, increases absorption of nutrients. It builds blood in the GI tract. Very important. It builds up, these herbs build up what we call intestinal metabolites. You know, from the intestinal microflora, the intestinal microflora, one of its main functions is to create metabolites, which include hormones like serotonin and catecholamines, etc., vitamins, peptides of all kinds, which feed the brain as well. Hence, we have the gut-brain axis, right? Very, very important. So we'll talk more about that in a moment, hopefully. I'm just emphasizing the importance of these sweet, moist, warm restoratives for not only for nourishing the microbiome, the intestinal microbiome, also called microflora, but also through the gut, because they create so many hormones and peptides, they feed the brain. There's a quick communication through the hormones, between the brain and the digestive tract, right? A big part of the nervous system is in the digestive tract, right? So these restoratives, these tonics are highly relevant nowadays, right? The sweet, moist, warm tonics. And I think in Western herbal medicine, at least when the way I was trained, we didn't pay much attention to these at all. It was only because when I studied Chinese herbal medicine, you know, that I really began to understand the importance of nourishing the blood, right? Which also means increasing nutrition, you know, increasing digestive metabolites to feed the body, to feed the brain, right? Okay, that's the second type of restorative are the astringents, which tend to be dry and cooling. They variously contain tannins, flavonoids, also saponins. They promote restriction or astringency. Astringent, many of them are venous decongestant to treat venous insufficiency, venous blood congestion. They also resolve mucus damp. I call them mucostatic. Mucostatic in order to stop excessive mucus production in the mucous membrane, causing discharge. It can be nasal discharge, phlegm in the chest, leukorrhea, etc., etc. Mucousy diarrhea, right? And then we have astringents to stop bleeding, hemostatics, coagulants, and so on. So these are the two. So in traditional Western medicine, the emphasis was always the dry, cool astringents, not so much the sweet, moist, warm, but now the situation is reversed. We really need to be using more of the sweet, moist, warm restoratives, like the white Asian ginseng, American ginseng, Panax, the Dangshan, Codonopsis dangshan from China. Also, there's another Chinese herb, I don't know if you have it, Polygonatum huangjing. It's a Solomon seal, Siberian Solomon seal. You can also use other types of Solomon seal, right? Also, the suma root that I mentioned, very important for an all-round restorative. Okay, so I hope this fills you in a bit more to understanding the way that I use herbs, in this big scheme and how they fit into the. Now you'll be able to understand more, I believe, how they fit into the terrain treatment that we're continuing. Okay, so now before we go back to the treatment of insomnia and brain fog and so on, I'd like to take another little stretching break, right? A 10-minute stretching break, and then we'll continue for the last hour. We'll focus exclusively on the herbal treatment of these disorders. Okay. So we will see you 58. It's on the hour. So let's gather together again at about 10 past, by 10 past the hour. Right? Okay. I will see you shortly.